Your tongue is stitching on you, your organs, your habits, your health concerns. And no, I can't literally read your mind, but after looking at your tongue, I might come pretty close. In traditional Chinese medicine, acupuncturists use tongue observation as one of the first tools used to diagnose internal disease. Sometimes changes on the tongue occur before symptoms even begin to manifest. So, what exactly are we looking at? Well, we might catch a hint at your midday matcha habit.
I have a disease. Matcha mouth.
We care more about the body color and where the color is located, the shape of the tongue coating, including the color, thickness, and placement, the moisture, depending if the tongue is wet, dry, or balanced, and any other small details like cracks, peak marks along the edges, small red marks, or the sublingual veins on the underside of the tongue. All changes on the tongue are important details for your acupuncturist, as the external changes reflect internal changes in your organs, fluids, and even the presence of pathogens. When we put everything together, it helps us link symptoms that might seem totally unrelated, like why you bloat when you get a migraine, or why your asthma has now progressed to include lower back pain. Here's what a normal, healthy tongue looks like in traditional Chinese medicine. The tongue is light red or pink throughout, with a thin, evenly distributed white or clear coating. The tongue is not swollen nor shrunken. The sides are nicely plump, but not scalloped nor puffy. Underneath, the sublingual veins aren't bulging or overly dark. The tongue surface is smooth, without any abnormal cracks, red prickles, or random indentations. And both sides look like mirror images of themselves. Now let's say your tongue isn't looking ideal. One of the most common changes is the presence of red coloring. A red tongue usually indicates heat within the body, with placement indicating organ involvement. Red side, liver heat. Your acupuncturist will rapid-fire questions about headaches, rib pain, your blood pressure, sleep, stress, and skin health. Red tip, heart heat. Get ready for questions about nightmares, insomnia, and related to your menstruation. Red root, that's heat in the lower organs. Could be a UTI, constipation, or even heavy menstrual bleeding. Red all over with horizontal cracks. This can point to things like menopause, diabetes, or even overuse of certain medications. A red tongue won't change overnight, but if you start acupuncture and make the suggested lifestyle modifications, redness on the tongue will slowly shift towards normalcy over weeks to months. And the same goes for any other tongue changes that stray from ideal. A normal tongue is achievable with consistent treatment. So, if you're coming in for acupuncture, here's my pro tip. Don't scrape your tongue before your appointment. You're hiding away key evidence that we need to make an accurate diagnosis. So no, I can't read your mind, but your tongue doesn't lie. Check the description box below for a free tongue map so you can start learning how to read your own tongue. I'm Dr. Madison Park. And remember, ice belongs in your freezer, not in your drink.